Good afternoon, everyone. Welcome. Thank you so much for joining us today on this beautiful, kind of brisk fall Sunday during a Patriots game. I expect that people are still be mourning over the Red Sox, unfortunately. So it's glad to see everyone here with us today to discuss this very important issue. My name is Zane Crew, and I'm the president of the Mystic Valley area branch of the NAACP. And today, the NAACP, along with the AdMeTech Foundation, is here to talk about prostate cancer prevention and the state of COVID in the Mystic Valley area community. The Mystic Valley area region encompasses several towns, cities, municipalities, including Malden, Medford, Arlington, Woburn, Winchester, Everett, and hopefully I'm not forgetting one, Arlington. And for over 40 years, the Mystic Valley area branch of the NAACP has been involved in this community from fighting for political, economic, social equity for all. Health equity is an important issue for our branch as well. We believe health equity is a civil rights issue, just like a lot of the classical issues, whether it's voting rights, policing in America, etc. We want to ensure that our communities are healthy and living long, fruitful lives as well. We want people in our communities to be safe from COVID, safe from health inequities that disproportionately affect communities of color, Black communities in particular, such as prostate cancer. And we believe we can reduce the negative effects of prostate cancer by educating people, ensuring people detect this cancer early on. As we strive for environmental justice, voting access, policing reforms, positive educational reforms in our school systems, housing reforms, job growth, we want to take the time to educate people also on health issues like prostate cancer, and most importantly, detecting this early. The goal of this event is to empower individuals to take charge of their health and reduce the health disparities of both COVID and prostate cancer. So I'm not going to talk too much on the cancer. I'm not qualified to talk about that. So today you're going to hear from some health professionals that are going to walk you through what is prostate cancer, how to detect it early, and leave you today with a better understanding of prostate cancer and health in general. So from there on, I'm going to introduce some of our representatives we have here with us today. So we have Senator D. Domenico here with us. We have Representative Day Donato. We have Representative Sean Garberly. And these representatives in the Mystic Valley area communities are champions of prostate cancer educational program for high-risk men, with the priority focus on African American and Hispanic men and men in particular in our communities. So first, I'm going to pass the floor to Senator D. Domenico, who's going to start.
Thank you very much, Zane, and thank you to you and NAACP and to AdMeTech and to our fierce advocate, Dr. Stern, who is always in our offices, and I can speak for everyone on this call. There's no one more tenacious on this issue for education and awareness than you, so thank you for all your work. It's great being here with a lot of my friends in the legislature and local government to talk about an important issue, a couple of issues actually, starting with COVID-19 and the health disparities and inequities that existed. They were only exacerbated because of this. We can all say the same speech here because this is what we've seen going forward. But we all talk about how we want to make things better during the pandemic, and some people say go back to where we were before. Going back to where we were before wasn't working in itself. The disparities that we saw during the pandemic existed long before the first COVID case in our community, and this has only been made worse by all the EJ talk you're talking about, environmental justice communities and our lower income communities. And the city of Chelsea, I know that's not in the Mystic Valley territory, but the city of Chelsea being the number one city at one point in the entire country that was affected by the COVID pandemic. And we know now that we thought we had some inequities. Now we know for sure how widespread and what the gap really looks like across our state. And when we talk about prostate cancer, it is obviously one of those issues, as you mentioned, Zane, that disproportionately affects the African American community, the Hispanic community, and the figures are startling when you think about the actual numbers. 1 in 9 men are affected by prostate cancer, but 1 in 6 members of the African American community and Hispanic community are affected by prostate cancer. We know early detection has much better outcomes. We know that screening and education is the way to go, and how important it is going forward. We know it's not the most comfortable thing to do. I know many of my colleagues mentioned last year, one being Mayor Christensen, how he fears doctors like I do. Um, and it's not one of those things that we talk about a lot among ourselves, right? And it's not something that is top of mind or even comfortable to talk about among friends and family. But it's so important that we have events like today that we take back to our communities as a whole and let them know how important the screening and the educational part of this is to our communities and to members of our own families and people that we know and people that we don't know, to try to make sure that we understand the issues at hand that are so important to our residents. So it's important for us to have these. I want to thank you for all that you do. Thank you for bringing us together as you do, not just at this event, but so many other events. And we have Dr. Stern, who's in our offices all the time. I miss seeing her because of COVID, but she was very frequent visitor to our offices and a very strong advocate and someone that did take no for an answer. She just was one of those, she's, as I mentioned, the word tenacious comes to mind when I talk about her. So thank you for all that you do. And I also want to just mention one thing too, make my pitch for vaccinations and booster shots. And I know we're at a time now where the boosters are coming out. I'm getting mine hopefully soon. But it is important that we combat this disease, this pandemic, by the remedies that we know work, by getting vaccinated and encouraging vaccinations in our communities as well. So thank you very much, everyone.
Thank you very much, Representative DiDomenico. So that was a great, insightful analysis. We do want to take away, you don't want to be fearful of doctors from this, just like, the representative and Mayor Christensen are. I'm not scared of any doctor, unless we'll count the dentist. I'm terrified of the dentist, but that's a story for another day. So on that, we're going to pass the floor to Representative Paul Donato.
Hi, thank you very much, AdMeTech, and to you, Zane, and to Doctor. I missed you. We love seeing you. I love seeing you at the office and having the opportunity to talk. Prostate cancer has affected, my family as well as other families throughout the country and throughout the world. And I think that one of the most important things that we can do with regard to prostate cancer is education and awareness. And, we can't fear the fact that we've got to go to the doctor and talk about this disease for men. We can't fear that. We've got to educate people that this is the important thing to do, to get screened, to get to the doctor and have that once a 6 months, once a invasive checkup. But at the same time, it provides the opportunity for you to know that if it's caught early, that it's curable, and that's the important part of it. It can be less evasive if we do it in an intelligent way. I'm proud of the fact that Massachusetts is high up in the ranks of vaccination with regard to the COVID. I too, like the senator, am looking forward in the next few weeks to get my booster shot, my Pfizer booster shot, and I think it's very, very important that we continue to educate people in the Commonwealth that this vaccination is very important and everybody should be doing it. So I look forward to learning once again from the doctors with regard to the cause, the effects, and maybe the opportunities to educate with regard to prostate cancer.
Thank you very much, Representative Donato. So that's the call to action also. Get your booster shot if you're eligible. I don't know if the doctor's going to let me get it yet. I'm only 31 failed old, but I guess I'm not booster age yet, but we'll see. If that's a call to action, we got to do what's necessary to keep going to Pats and Red Sox games and not worry about getting people sick and dying. So let's keep that going. So now I'll pass the floor to Representative Michael Day.
Thanks, Zane. Really appreciate you stepping forward here, hosting today on behalf of the Mystic Valley branch of the NAACP. And also, Dr. Stern, thank you for your leadership, for your decades of leadership in cancer research, from the moonshot with now President Biden, straight through with the work that you do here at AdMeTech. Hugely important. As Representative Donato said, education on this end, I think particularly with prostate cancer, the awareness of the prevalence of it, as well as the prevention of it with regular checkups is hugely important. And AdMeTech has been doing terrific work in this space for well over 20 years of work on this end. Good to see my colleagues here today on a Sunday as well, which underscores, I think, just how important this educational drive is. AdMeTech has been a great partner, I think, with the legislature in the state, stepping forward to fill a void in this area. We've happily increased the budget for AdMeTech this year up to $1 million. In this past budget, we're hoping to do so again and increase it even further moving forward. I think one of the pieces that often gets lost in the pandemic, in addition to the importance, and I'll underscore my colleagues' plea for vaccinations to make sure that we get our numbers up. We're doing well comparatively to the nation, but certainly not well enough, I think, in our area here or in Massachusetts. In general, we can do much better. So I'd underscore that. But I think one of the crucial pieces, what we're looking at now is, given the pandemic and the rollback of folks going to see their doctors in person, going to make sure that they have regular checkups, is the fact that screenings are down over the last year, over the pandemic. Some of that's obviously something that you could anticipate while we were sheltering in place in quarantine. But now that it's opening back up and we're finding a new sense of normalcy, which we can increase with more vaccination, we've got to make sure that folks get back out to their physicians to make sure these screenings are occurring on a regular basis. Because, as Dr. Stern will tell you, this is a treatable and preventable, from a fatal perspective, disease. One that, with early detection, early screening, can be beaten, as Senator DiDomenico and Representative Donato have, and I'm sure Representative Garbely can say, all of our families have been impacted by prostate cancer. We've all got individuals in our families who are dealing with it, and those individuals are, thankfully on my end, ones that are battling this disease well because of the early prevention. And AdMeTech's a huge part of that puzzle for us to make sure that our population understands the importance of screening and understands the life-saving nature of that. From Zane's piece, I think you heard Senator DiDomenico talk about the rates of prostate cancer in our communities of color. Again, we need to do a better job of making sure our brothers and sisters in our communities of color know the importance of this, know the access is there for screening, and take advantage of it, because these are preventable fatalities. So with that, I would say again, thank you to Zane and to Dr. Stern for convening this today, for all your work going forward in making sure that our communities are healthier and we're able to address preventable diseases earlier. Thanks.
Thank you very much, Representative Day. Thanks for being with us, and thank you for all your work in the community as well. So,
Zane, I just underscore, as a person of Irish descent, I share your fear of dentists, and remind you that Stoneham is here as well.
Sounds good. Stoneham in the building too. Beautiful. So now we're going to pass the floor to Representative Sean Garbely, who's a known figure, a celebrity in Arlington and Medford communities. And normally, you'd catch him on the Cape or catch him on a boat or catch him with his dog. But now we finally got fall weather in New England. So now we got him in his Sunday's best. And he's with us here today. So Representative Garbely, the floor is yours.
Thank you, Zane, I think. Thank you so much. First of all, Zane, thank you for all the great work you do with the Mystic Valley NAACP. It has been outstanding to partner with you and the organization to encourage that more individuals get vaccinated. You and the NAACP have done truly amazing work. And so really appreciate your work and your work on this issue and the collaboration with AdMeTech, with Dr. Stern. Dr. Stern, I just want to say, it's been echoed by the sentiments of some of my terrific colleagues in the legislature. You have been so active before COVID, during COVID, I know you will be after COVID, in the building, educating lawmakers and being effective in doing so. Rep. Day mentioned the earmark that we're able to get for AdMeTech, which really does outstanding work in educating men across the Commonwealth of Massachusetts. As Senator DiDomenico mentioned, 1 in 8 men will be diagnosed with prostate cancer. That's an alarming rate. That's the most common cancer for men in America, besides skin cancer. So many men across this country will be diagnosed, as Rep. Donato mentioned as well, and Senator DiDomenico and Representative Day. The rates among Hispanic Americans, Black Americans are disproportionately impacted by prostate cancer compared to the 1 in 8 number. So scary statistics out there. But what is a relief is that with early screenings, more treatment options are possible. And so the earlier we get screened as men, the more treatment options will be available for men across Massachusetts, across our country, and in our legislative districts. So this event is critical. I think Representative Day mentioned how important it is to get screened, but also now with screenings down because of COVID, we need to really educate our district and the men in our districts and across the state to get screened, because your treatment options will be that much better and more thorough with early screenings and early detection. So again, I'm thrilled to be here with the NAACP, with AdMeTech and Dr. Stern and the other doctors on this call, and also my legislative colleagues, Rep. Donato, Rep. Day, and Senator DiDomenico, and Mayor Christensen. I am spoiled with terrific colleagues, and this is just one of the issues we collaborate on. So thanks so much, everyone, for being on this call, and get screened.
Thank you very much, Representative Garbely. Thank you so much for being with us, and thank you for all your work in the community as well. Excuse me, apologize. The sun is a little crazy in my room right now, so. But now we're going to pass the floor to the legendary Mayor Gary Christensen, longtime mayor of the city of Malden, which Malden's been doing a lot of great things recently under Mayor Christensen. They've been taking a lot of emphasis on Juneteenth right before it became, a national holiday. The city finally has it's taking D&I more serious with a diversity officer. A lot of towns and cities been doing this. Glad to see Malden is doing the same, and they're going to be expanding their D&I initiatives. So want to shout out Mayor Christensen for that. So now I'll pass the floor to him to give an update on what's going on in Malden.
Thank you, Zane. And let me just say that the things that you mentioned, you were the impetus behind them. So I do want to thank you and your organization for continuing to work with us on those most important matters here in our community. I also just want to take a minute to let Dr. Stern know, I don't know where Thomas ranks in your organization, but move him up, because he's done a great job organizing this event here today. I think he reached out several months ago and stayed with it, and look where we are today. We're all together, and I do want to publicly thank Malden's own Thomas for doing that. And I just want to say, too, I wouldn't be able to talk to you today about where we are with COVID if it weren't for the legislators on this call. When we were notified we had our first COVID case here in the city, as you can probably imagine, the financial picture for us changed overnight. And if it wasn't for Senator DiDomenico and Representative Garbely, Representative Day, and Representative Donato stepping in to prop us up during those crazy 18 months, I am certain that we would not be where we are today, which is from where we once were to where we are now. I'm happy to say Malden's positivity rate as of this weekend is 1.6%, which, if you had asked me back in the fall if we would have ever seen those numbers, I would have said no. But again, thanks to everybody on this call, along with our Diversity, Equity, and Inclusion Officer, Bibios LaRochelle, and we now have someone working outreach in our health department, Tammy Rock. And of course, like most things here in our city, we had a lot of community organizations step up to assist us to helping get the word out about the importance of vaccination. So the Greater Malden Asian American Community Coalition, even next door, the Everett Haitian Community Center joined forces with us. And as a result of that, Malden is now roughly 70% fully vaccinated. And the thing that's really impressed me about those percentages is that our youth, 12 to 15-year-old and 16 to 19-year-olds, are in the mid 60 to high 60 percentile, which is not surprising to me because they've really led the way on a lot of issues here in our city. But that has contributed to us, again, being upwards of 70% now fully vaccinated. So what we have to do, as everybody mentioned on the call, is just not let up. In talking with the state recently, they said if you need any proof as to how vaccinations are making a difference here in Malden and beyond, is their data was telling them the Delta variant, which was the one we were really concerned about recently, was being made up of less than 1% of those who were fully vaccinated. So to me, that says it all. Not only we're making up the cases, but also hospitalizations and deaths. So we're going to be doing a 30-second COVID show on our local access channel, Urban Media Arts, on Wednesday, October 27th at 6 p.m. If anybody here was interested, it'll be live where people can ask questions. They can call in as well. And we're just going to continue on, even though these numbers that I outlined to you today are very healthy. We're not going to stop, especially as it pertains to race and ethnicity, which our latest numbers show that our Asian American population is at 66% fully vaccinated. Our Hispanic is at 60%. The one that we need to continue to work on is with Black Americans. So we're at 40% fully vaccinated. Now, that is a low number, but from where we once were in the fall, I think it was in the 15 to 20%. The efforts of the Everett Community Haitian Center, along with the GMAC, and especially our health department working with our Diversity, Equity, and Inclusion Officer, have been able to drive those percentages up. So again, I want to thank you all for the work that you're doing. Thank you for having us on here today, and let us continue the work that is needed to get us to where we all want to go.
Thank you very much, Mayor Christensen. Glad to see you today, and thank you so much for your work in the community and your efforts on vaccinations. We certainly have to do something to pump those numbers up among African Americans. 40% is not doing it. We need to get to the necessary numbers so we can end this pandemic. And from that, I'm going to introduce Dr. Sardella, who's going to give some insights and metrics on the state of the pandemic and his insights on what we have to do to end the pandemic, which I think we should really listen to today. People getting information from a lot of sources, whether it's, Fox News hosts who are 100% vaccinated, telling you, hey, maybe you shouldn't get vaccinated. Or maybe popular musician like Nicki Minaj's cousin telling you, hey, maybe this will stop you from having babies or something. Or maybe it's taking advice from the Boston hero, favorite athlete of all time, above Larry Bird, above Tom Brady, Kyrie Irving. Maybe we should listen to Dr. Sardella instead of taking insights from some of these people. So I'm going to pass the floor to an actual doctor from there. Welcome, doctor.
Great. Thank you, Zane. Thank you for inviting me to talk today. You made an excellent point right now. There's information coming at us in so many different directions that everyone has to choose what is their source of truth. I can tell you from running an operation where we're actually caring for patients who've been sick enough to come into the hospital. Our source of truth is the CDC, and that's just it. It's too bad that the world of people being able to offer an opinion and picking the science that they want to follow really is making this a little bit difficult to care for. But just like Representative Dave mentioned, Massachusetts in itself is in a very good position compared to a lot of other areas in the country. It's actually been doing so well, and the vaccination rates have been so high compared to other areas of the country that it's helped considerably. But it's still occurring, obviously, and it still should be one of our major concerns. Over the last 3 or 4 months, the numbers across the state of Massachusetts and individual hospitals have relatively plateaued. It's sort of a steady state, and on the lower end, people requiring hospitalization. But the numbers of people who are coming up positive and being able to go home and take care of themselves is still remain relatively high, and that's our main focus right now. I was when we first went through this process, over the first 3 or 4 months of the pandemic, and over the first 3 or 4 months of having vaccines available to us, it really, really brought to light the inequity that we all function in, And we've made strides, I think, to really improve that over time, and working closely with some of the community organizations, especially in hotbeds like Everett and Chelsea and Malden initially. So it just, but bottom line, here's where we're at. Over the last 2 months, we've relaxed a lot of the restrictions, or some of the preventative measures that we put in place, and I can understand why we've done that. And if you notice around our communities that people are not sticking to the recommendations of wearing masks and distancing and so forth, I completely understand that. A lot of us in the hospital setting can actually understand that, but that is so important, because we still have to control the flow, and what those processes do is they interrupt the flow of the virus, and that's what really will help. If you look at some of the countries around the world who have the best numbers, they've actually done a very good job at maintaining those preventative measures. You talk about preventative for prostate or other diseases. That's a preventative measure for possibly picking up COVID. The biggest thing we've learned, though, and the actual process in the scientific world from the CDC and the FDA is the importance of the vaccine. Vaccines really are not meant necessarily to create a situation where you will not get the illness. And what it does is it creates a situation where if you do come in contact with the illness, you have a better chance of having much of a less or a dampened response to it. And that's what we're finding right now. The vaccination numbers in Massachusetts, even though there are pockets of lower numbers, are high enough where we're actually seeing a number of instances where patients, individuals, have cold symptoms, and really it's COVID, but they've maintained that ability to fight off the virus because of the vaccination and the vaccine. The thing about this, which makes it so different from anything else we've come across in my 30 years of doing this, is the importance of the vaccine is because this is a new virus that none of us have ever come in contact with. We build up immunity to things by coming in contact with it little by little over the years of our life, but this was something brand new. So every single one of us started fresh, and what the vaccine does, and the science of it, is it really helps your body create the protection it needs to fight off the infection if and when you will come in contact with it. And if you think of the combination of us in the community relaxing some of the interventions that interrupt, like masking, the more we relax that, the more important the vaccine is, because you will come in contact with someone. You just will, and you won't know who that person is. And the best thing you can do is go through the process of vaccination. We absolutely understand the hesitancy that some people have about receiving the vaccine in all areas, in all cultures. It's a scary situation, but I think working with a consistent message of the representatives and senators and the community groups that you all support is really the best way to go. And when we follow individuals that have an opinion as opposed to the science, like the few names that Zane mentioned in the beginning, those are opinions. There's nothing. The science doesn't back it up. What we should also remember too, and I found this when I first heard that this was a combination discussion between COVID and prostate cancer. The thing we've done in the last 18 months is we've forgotten about all those other diseases that we have to keep track of. One of which is prostate cancer, other which is any other disease or illness that someone has. And that what you'll see also that's happening right now across this whole area is physicians' offices and clinics are opening back up to doing in person. You should really, really not hesitate to seek medical care or recommendations because you might be afraid to go into a doctor's office because people might be sick in a doctor's office. That doctor's office is shut down. They're now opening up, and it is incredibly important to to pay attention to any illness that we potentially have and any screening process that we potentially have, especially your talk today on prostate cancer, but really all the other illnesses. I can tell you across the state, hospitals are full, and they're full mostly with non-COVID patients. And those are patients who have held off seeking care because of the fear of coming out into the community and getting the screening and care, direct care that they need. So at the end of this, I'm more than happy to answer any question you might have about vaccines and how they're formed. We have, just so you know, right now, as of this weekend, or starting next week, the opportunity to receive any vaccine and mix and match is really opens up the door. Back when we started this, part of the inequity was really based, which was an eye opener for a lot of us in the medical world, but it was really based on lack of supply also, and how to spread that supply. There is no lack of supply right now. Vaccines are easily obtainable, they're accessible, they're being delivered in multitude of venues, of businesses, and can be brought to people. It's just, the world has changed, and it's something that we should all take advantage of. So, thank you, Zane.
Thank you so much, Dr. Sardella. Dr. Sardella is the Chief Medical Officer of Wakefield Medical Hospital. So someone that's more credible to talk about things than Tucker Carlson or Kyrie Irving, I would like to say. So from then, I want to introduce another doctor we have with us. So Dr. Stern now. Dr. Stern is the president of AdMeTech Foundation. So Dr. Stern is the founding board member as well, president and CEO since 1997. Dr. Stern has been focused on prostate cancer since 97, which is a very, very long time. I think I was in first grade in 97. So that is a ton of experience researching and giving presentations on this. Prior to that, Dr. Stern was focused on the cousin of prostate cancer that affects women primarily, which is breast cancer. She's won multiple awards and is lauded in her field and lauded across the state for all her amazing contributions she's done in cancer research and doing what she can to make our society a better and safest place. So from that, I want to introduce Dr. Stern.
Thank you so much, Zane. It is a pleasure to have our second annual event on COVID and prostate cancer in Mystic Valley. Thank you for your partnership and thank you for your support. This event would not have been possible without legislators present today, Senator DiDomenico, Representatives Donata, Day, Garbalay. They have been instrumental in our ability to undertake prostate cancer program. Also, I would like to acknowledge staff of AdMeTech who is present here today, including particularly Thomas Satam, mentioned by Mr. Christensen. Thomas, we've promoted Thomas as high as we could, I can assure you, in AdMeTech Foundation. We appreciate and love him. And he will be promoted as much as we can promote him. Closely with Thomas, Ali Adam is working very close to Thomas. She's outstanding. And so is our intern, who is currently in a master's program at Clark University, Emma Colliard. Guys, thank you so much for being here today, and thank you for making it possible. Now, because of concern regarding internet instability, we actually pre-recorded my presentation today. Ali or Thomas, if you will be kind enough to start the video. I'd like to express my gratitude to Zane Krug for the opportunity to address prostate cancer awareness in the times of the COVID pandemic. This event is a part of the AdMeTech Foundation's ongoing program in prostate cancer awareness and education in Massachusetts, with primary focus on African American and Hispanic men. Our program was initiated in 2014 in partnership with multiple community organizations and strong support by Senator Sal DiDomenico, Representatives Day, Donata, and Garbalay, who are taking part in this event. Both COVID-19 and prostate cancer have emerged as leading health disparities in Black and Hispanic communities. In April last year, early in the pandemic, we have recognized that the areas of prostate health disparities directly overlap with the pandemic hotspots. Since May 2020, we have expanded our program to include education about prostate cancer and COVID-19. Prevention and early detection are critical for saving lives and eliminating disparities in both prostate cancer and COVID. The future of this pandemic depends on us. What can we do to end this pandemic and protect our families and communities? We can drive down infections drastically by wearing masks, particularly indoors or in crowded outdoor settings, in combination with reducing social contacts. If we develop flu-like symptoms, we can ensure early testing and self-isolation and help public health experts to trace our contacts. We can end this pandemic by complying with vaccinations. Masks are the best tool we have for preventing spread of infection. On this slide, you can see predictions from the leading medical forecasting group at University of Washington as recent as October 15. If most of us use masks, our state is predicted to have less than 600 cases per day by January 1, including asymptomatic infections that may go undetected. In sharp contrast, if the current low compliance with masks continues, our state will have over 6,000 cases every day at the same time. Vaccines are the best tool we have for ending this pandemic. On September 13, CDC reported that in fully vaccinated people, infections were reduced 5 times, with hospitalizations and death reduced over 10 times. COVID vaccines have been proven safe and effective in millions of people aged 12 and older. We are much more likely to get into a car accident and sustain a serious injury than develop significant complications of COVID vaccines. Many experts pointed out that the vaccines could have prevented over 97% of hospitalizations and death we are seeing today. Vaccines are the best way to protect not only ourselves, but also our families and our communities. By accepting vaccinations, every individual help us get one step closer to ending this pandemic. Since early last year, more than 5 million children were diagnosed with COVID. In the first week of September only, new COVID cases in kids reached record levels, and the situation is expected to get worse. Our masks and our vaccinations protect our children. In mid-September, Boston Globe columnist Renee Graham wrote an opinion, "The unvaccinated and the orphans they leave behind." Citing scientific evidence, she pointed out that 120,000 kids lost their parents or caregivers to COVID in this country, with Black kids impacted disproportionately. She raised an important question. Can we allow our hesitancy and fear of the COVID vaccines define our kids' future? Several months ago, U.S. Surgeon General Dr. Vivek Murthy shared publicly that he lost 10 members of his family to COVID. He pointed out the masks help us reduce spread of infection, while vaccinations remain the bedrock of ending this pandemic. While we are dealing with the pandemic, prostate cancer cannot wait. And yet many men avoid visits to their doctors out of understandable fear of contracting the virus. Unfortunately, delays in care can cause reduced quality of life and even loss of life. It is important to point out that clinical facilities created a safe environment for patient care, including virtual visits and telehealth, ongoing in-person care such as physicians' visits and testing, medical procedures, biopsy, and treatment. Ongoing care is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to Caucasian men. However, early detection saves lives and eliminates health disparities. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive at the same time. In prostate cancer, screening with blood test called PSA is the best tool we have for prevention and early detection, critical for saving lives and reducing health disparities. During pandemic, it is more important than ever to take charge of your prostate health. It is important to know your risk factors such as African ancestry, family history of prostate cancer, particularly brother or father, and increasing age, 50 years and older. You can ensure early detection. During the annual visit, ask your doctor about PSA blood test and digital rectal exam. You need to talk to your doctor starting at the age of 40 if you have risk factors, or at the age of 45 if you do not have risk factors. Before screening, it is important to avoid exercise or sex, which may impact your testing results for 1 week. After screening, you need to ask your doctor if your test is normal or if you need referral to a prostate cancer expert. 2 weeks ago, AdMeTech Foundation held a virtual global summit on precision diagnosis and treatment of prostate cancer. Our goal is threefold: educating medical community and general public, reaching consensus on the best clinical practices and research priorities, and expediting transfer of the cutting-edge advances in diagnosis and treatment to patients. Screening of prostate cancer reduces death by more than 50% and has been more successful in that regard than many other established cancer screening programs. Our summit has brought together the key international experts representing every clinical expertise who highlighted the important advances in screening, diagnosis, and treatment. In men before diagnosis of prostate cancer, we have seen rapid advances in diagnostics, including rapid development of blood and urine tests for molecular markers and imaging tools such as MRI, which created a new standard of care. We have also seen that integration of molecular markers and imaging improves identification of men who are at higher clinical risk of life-threatening prostate cancer and need to undergo biopsies. Conversely, this accurate diagnostics also eliminated a large number of unnecessary biopsies. Our summit suggested that at this point, men who are referred for biopsy based on PSA screening alone should ask for additional testing to determine more accurately if biopsy is needed. I think it is fair to say that traditional biopsy, which is blind to prostate cancer and performed without accurate imaging such as MRI, is slowly but surely moving into the dustbin of history. In this slide, MRI guides biopsy needles to prostate lesions with great precision. Health disparities of our summit highlighted the importance of MRI in Black men who are likely to have lesions in the front part of the prostate that cannot be reached by physical exam or traditional blind biopsies. Our summit also highlighted the importance of assessing genetic predisposition to prostate cancer. Testing for genetic mutations is particularly relevant for men with family history of life-threatening prostate cancer and other malignancies, as well as for men with high-risk local, regional, or metastatic prostate cancer. Genetic counseling is preferred prior to testing for men with family history and after positive test for genetic mutations. In men with proven prostate cancer, there are two pillars of the current diagnostics, MRI and genetics. While MRI shows cancer location, genetic analysis reveals underlying cancer biology, indicating the likelihood of clinical progression. With this precision, we can now accurately determine if each individual has a harmless disease and needs only careful observation, or an aggressive prostate cancer requiring immediate treatment. Our summit's health disparities panel concluded that access to care is the key factor in eliminating health disparities. It is particularly relevant to our state with its universal access to care. We are here today because with appropriate patient education, combined with access to high-quality care, we will be able to achieve prostate cancer equity in Massachusetts. Towards this goal, we recently expanded our community education and awareness to include a program for improving access of African American and Hispanic men to high-quality clinical care. To achieve that, we have been working with leading state experts in prostate cancer and research who have the most advanced diagnostic and therapeutic resources available today, like Dr. Caesar in the Melrose Wakefield Healthcare, participating in this event. In parallel, we are leveraging extensive partnerships AdMeTech has built with multiple community organizations to let everyone know about this opportunity. These organizations include, but are not limited to, New England Area Conference of NAACP and its Mystic Valley branch, and Latino Health Insurance Program. This program is open to any individual who would like an expert consultation or receive a second expert opinion about every aspect of patient care. For example, men who would like to discuss questions if screening is right for them, or their screening results, to consider if further non-invasive testing is needed prior to biopsy. Possibility of invasive biopsy and related choices. Family history of prostate cancer and possibility of genetic testing. Diagnosis of prostate cancer and related treatment options. Complications experienced after biopsy or treatment. Evaluation after treatment to ensure early detection of cancer return or progression. Summer Mills, a member of our staff, serves as a statewide clinical coordinator. If you have any questions, please contact Summer by phone 617-523-3535 or by email equityprojectcoordinator@admetechfoundation.org. In summary, prevention and early detection and related public awareness and education save lives and reduce health disparities in both COVID and prostate cancer. Masks and vaccination prevent COVID infections, hospitalizations, and death. Advances in screening and diagnosis created a precision, individualized approach to prostate cancer care. Thank you for your attention.
Thank you very much, Dr. Stern. Thanks for sharing that with us. That was very informative or whatever. We also have Dr. Caesar with us, who was mentioned during Dr. Stern's presentation. Dr. Caesar is a urologist at Melrose Wakefield Healthcare. So he's one of the best and the brightest in the field in the Bay State. So I'd like to present Dr. Caesar to give us some more insights on prostate cancer.
Thank you, Zane. And thank you to Thomas. And a special shout out to Judy Sadaka for helping me with the presentation today. Everybody that spoke so far really highlighted the issues with prostate cancer and how really it affects the African American community much more so than other communities. And I think our focus today is to help our colleagues and our patients come to understand the importance of screening and understand also that years ago there seemed to be there was a trend in urology where everybody who was diagnosed with prostate cancer underwent significant treatment, and which led to complications, impotence, problems with incontinence. Now, as Dr. Stern had pointed out, we have very sort of focused diagnostic techniques to kind of determine which patients will go into biopsy and which patients we think may have aggressive prostate cancer. And those are the ones we want to really focus on. The ones who, and I'll talk a little bit in my talk about the watchful waiting and active surveillance, we can actually determine which patients will best be served by that approach, and thus not everybody will need radiation or surgery for their prostate cancer. So, and as Dr. Stern pointed out, MRI and genetic testing with the testing like 4K and other things has been extremely helpful, pointing out which patients will benefit from biopsy, because biopsies have its risks, as she mentioned, infections and other issues that go along with it. So we're really becoming a lot more focused on tailoring the treatment for the patient. So with that, I'll ask Tom to start with our slides, and I sort of wanted to bring out the football theme today as the Patriots are playing. So this is a talk about prostate health in the 21st century. We're also going to touch on BPH, which affects the quality of men's lives in a big way. It's much more common than prostate cancer, but I thought I would mention a little bit about what we're doing at Melrose Wakefield in patients with this issue with BPH. So I'll ask you to go to the next slide. The Urology Care Foundation is a foundation sponsored, one of the sponsors of the AUA, which is our main organization, and these slides are based on their foundation. Next. Prostate health is like football, depends on members of the team, and the urologist is probably the head coach leading the healthcare team and sort of will facilitate what's best, I think, for the patient. Next. So it really depends on, any football fan knows that the best offense is a good defense. So we have to start by knowing our bodies. As you age, your prostate becomes larger. It's a normal part of aging. And as I mentioned, the most common problems are non-cancerous. They're an enlarged prostate or benign prostatic hyperplasia. And many men have these issues of BPH by, and we'll talk about it, frequency, urgency, hesitancy, and things such as that. But we know that the digital rectal examination and the PSA is critical to determine prostate cancer or those who need to be, potentially biopsied, and we'll talk a little later about that. Next. First, a little bit about BPH. We'll talk about what some of the options are for benign prostatic hyperplasia. And we're actually just introduced this newer technique at Melrose, which is actually the first hospital in the Boston area to have this type of therapy, which is done nationally now, but it's just starting in New England. And one of the beauties is it actually allows men to spare sexual function, ejaculation, and continence. So it's a very cutting edge technology that we're now doing here at Melrose Wakefield Hospital. Next. So what's an enlarged prostate? We know that it comes along with age, and family history is critical. Obesity and diabetes are also risk factors for an enlarged prostate. We diagnose this usually with examination, digital rectal examination. And if you have symptoms, and we'll talk about that, such as frequency, urgency, you really should make an appointment to see one of the urologists in your area. Next. So this is just a little diagram about understanding BPH. We know that the prostate is an important gland during male sexual function. So during a man's life, it helps with nourishing the sperm. Unfortunately, once men are sort of done with childbearing years, it's just a source of aggravation. So it grows larger and it can cause severe health problems. So a BPH is a prostate that is going to be larger than normal. It is not prostate cancer. And you can sort of see how the urethra is compressed with a large prostate on the diagram below. Next, please. And this is just a schematic of the anatomy of the prostate and where it lies. And who's at risk? Men at the age of 50 or older, men whose fathers have had BPH, men who are overweight or obese. And the symptoms include incomplete emptying, urinary frequency, stopping and starting of your urinary stream, urgency, weak stream, and straining to urinate, as well as getting up at night more than twice. Next. Two categories of this LUT syndrome, lower urinary tract syndrome, include the urgency, frequency, nocturia, and incontinence. And there's the emptying the bladder technique, which is straining to urinate, dysuria, hesitancy, and weak stream. Next, please. And when you go to the urology office, you'll sort of ask to fill out this questionnaire. This just allows us to sort of quantify the severity of your symptoms. So there are several questions we'll ask regarding incomplete emptying, frequency, urgency, weak stream, and straining, as well as how often you're getting up at night and whether it's affecting the quality of your life, which is the most important question. Next, please. So the exam will include a physical examination. We will review your symptoms, and we may want to do some testing to see how well your bladder empties. Next. So the types of treatments are either watchful waiting, and really depends on how severe the symptoms are. Then there's medication, and then there's surgery. And really every patient is unique and depends on again, what their symptoms are and what their findings are when they see the urologist. Next, please. Can you prevent BPH? Not really. Unfortunately, the best things to try and lower the risk of your symptoms are to lose weight and to watch your blood sugars and exercise on a daily basis. Questions to ask your doctor: are my symptoms caused by an enlarged prostate? Should I be screened for prostate cancer? Will my symptoms get worse? What are the risks and benefits of each treatment? What should I expect after treatment? How should I handle incontinence? And what should I do if I have it? And erectile dysfunction. Next, please. So now I thought we'd talk a little more about prostate cancer, which is really the focus of today's top session. As many of you mentioned, prostate cancer is leading diagnosis in men with cancer. It affects 164,000 men. And as appropriate today, watching the Patriots game, that means there's 2 times the number of fans seeing the Patriots play at Gillette who are being diagnosed with prostate cancer this year. So it's very common. More than 29,000 men died last year in the US from prostate cancer alone. So who is at risk? We know that 1 in 9 men will be diagnosed with prostate cancer in their lifetime. African American men face higher risk. 1 in 6 African American men will be diagnosed. And 1 in 5 men whose brothers or fathers had prostate cancer will also be diagnosed. What are the symptoms? In the early stages, you may not have any symptoms at all. And that's why screening is so important. In the latter symptoms, you may start to have difficulty emptying your bladder. And when it's advanced significantly, you may have pain in various bones. Next slide, please. So 1 in 9 men will develop prostate cancer in their lifetime. Next. 1 in 6 African American men are more likely to be diagnosed. How do we screen? So there are 2 tests that are done: the rectal examination and the PSA initially. As far as screening goes, I tend to advocate screening for African American men at the age of 40, or anybody who has a family history of prostate cancer at the age of 40. And at 50, we start to test routinely men who are in the other categories. PSA is a protein that's made only by the prostate gland. And when it's elevated, it could mean either an enlarged prostate or prostate cancer, or sometimes prostatitis, which is an inflammation of the prostate. As I mentioned earlier, we were using this 4K score, which is a genetic test, which is more sensitive for prostate cancer than just regular PSA. So Individuals have an elevated PSA will also get the 4K score. If that's elevated, then we'll go on to an MRI of the prostate, which is a very good imaging study, as Dr. Stern pointed out, that we can use our fusion techniques to biopsy the prostates exactly and target those lesions seen on the MRI. And we do that routinely at Melrose Wakefield. So that's sort of the state-of-the-art technique for diagnosis of prostate cancer is with MRI and the 4K score. Next. As I mentioned, 1 in 5 men will have fathers or brothers who are diagnosed with prostate cancer. Next, please. Is it right for you? Well, you should be screened, as I mentioned, if you're above the age of 50, I believe. And we have various tests that will determine if you need to have a biopsy done, such as the 4K or the MRI. And you know, I just think it's important to have that screening done on every male. Next, please. 164,000 men will be diagnosed this year. Next, please. And, you know, as I mentioned earlier, the game plan for prostate cancer that hasn't spread, most of our patients now are being observed or surveyed. And the ones that have a low risk of disease progressing, we just follow them with yearly PSAs and possibly MRIs to see if there's any progression. Probably about 15% of those patients may progress. So those are the ones that will ultimately go into some type of treatment. But right now, a good number of our patients are under active surveillance and are being watched, and it's appropriate for them because we know that the prostate cancer is not going to cause them any significant problems in the future. Those that have more advanced disease, are more high-grade disease, then we'll recommend localized therapy, which includes either radical prostatectomy, which is surgery, or radiation therapy. Next, please. So we determine if the prostate cancer is advancing by various imaging studies, bone scans, and CAT scans. We also have this genetic test. So once we do the biopsy, we can actually send the biopsy to a lab to look at how advanced and how aggressive the lesion is. And if it's very aggressive, then we recommend treatment. If it's not very aggressive, active surveillance is appropriate. So if you have advanced disease, some of the treatments include hormonal therapy. Now we're using other types of chemotherapy, and actually the treatment for advanced disease has really improved significantly over the last several years. So it really cut down the morbidity and mortality of this disease in a big way. So I think we've come a long way thanks to some good research being done by my colleagues at the AUA. And working as a team, you know, work with your primary care physician to talk about these issues. And then we highly recommend that if there's any concerns to set up a visit with a urologist. You're not alone. Next, please. As I mentioned, new treatments are available. Next, please. Our goal is to improve the health of all of our community, particularly our folks, our colleagues in the African American community, who this affects more than others. Okay, well, I want to thank you for having me today. Certainly, there's my phone number if you want to write it down and set up a time. We can certainly see you and set up a visit if you're interested in screening for this disease. Thank you, Zane.
Thank you very much, Dr. Caesar. I feel like for that insightful analysis, I'm getting fantasy football points just for all that knowledge you hit with.
Thank you.
So now I'm going to pass the floor back to Dr. Stern, and we're going to field any questions anyone from the audience might have in regards to both the COVID-19 pandemic as well as prostate cancer. So now's the time to get your questions in. If you want to hear more from the health professionals, if you want to hear some more about football or more about what the Pats are doing, or any questions you got. Let's open it. Dr. Stern, the floor is yours.
Thank you so much, Zane. Does any panelist have any questions to Dr. Spardea, Dr. Caesar, or me?
I have one question I did get from the audience. The question was for specifically for you, Dr. Stern, but it might also encompass Dr. Caesar as well. there's a question wondering if some of these presentations will be made available.
Absolutely. Zane, we will be very happy to turn over the video and the slides to you so that you can distribute this to anyone in the Mystic Valley community who is interested in.
Sure, I'll definitely do that. Thank you so much.
We also will videotape the entire event. And we will send you a link to the entire event. It will be housed on our YouTube site. It will be housed on our Facebook.
Excellent. Thank you.
And my presentation as well. Dr. Thomas has the presentation. You're more than welcome to use it.
Thank you so much, Dr. Caesar. And once again, Dr. Caesar's presentation, Dr. Spardella's presentation, all of it will be, my presentation will be a part of the video of this event that will be publicly available. Any other questions from the panelists? And once again, we would invite anyone who is interested in a expert opinion about any aspect of prostate cancer to write to us at equity clinical coordinator at AdMeTech Foundation.org. If you have any questions at all, they would be welcome. And if necessary, we will contact somebody like Dr. Caesar to help out clinically.
I guess I'm getting another question too. Is this information also available in different languages? Like we have a lot of Portuguese speaking folks in the Mystic Valley region. We have a lot of Haitian Creoles, Spanish, obviously.
We do have, Thomas has a one-pager, Zane, that was translated into Hispanic, Portuguese, and many other languages. So if you're interested to get a one-pager, particularly with the focus on whether or not men should undergo screening, Thomas is your man to get this information in any language we could imagine would be needed.
Perfect. I guess that's some of the messaging we should do when we share with our branch members that, we have this information, we have it in different languages. Don't be bashful. Come get the information. You want it in Portuguese, you want it in Spanish, we got it. Anyone else have anything else? Any closing comments? Anybody else have anything else? Patriots update, anything?
Zane, I just want to say what a wonderful, informative presentation this was, and I'm happy to have spent the time getting educated.
Thank you so much, Representative Donato. We really appreciate your time being here on a Sunday as well. Anybody have anything else? If not, I guess we can close.
Have a good afternoon.
Thank you.
Thank you so much, everyone. Appreciate the time.
Thank you.
Thanks all. Stay well.
Early detection is key.